So we're going to turn now to our own Dr. Joe Sirven. He's in house making his monthly house call. We're going to be talking about a variety of things, medical headlines, and taking your questions. He will answer questions really on any topic that you have. So give us a call at 904-549-2937. Dr. Joe, we should, before we pop into this, remind people, Jacksonville City Government is closed today. Duval County Public Schools are closed today. Um, Catherine Abbey, Hannah Park, and Huguenot Memorial Park. The libraries are all closed. Early voting's been pushed back to Wednesday. So if you have plans today, make sure that you check to see if, the facility is even open, and you are advised to stay off the roads. Um, Dr. Joe, nice to see you.
It is always good to see you, Ann,
Thanks
even
for
on this rainy day.
I know, I was like, this is a really challenging day to make a house call. So
Exactly.
thanks for being
But
here.
it's good to be here.
So Dr. Joe, of course, is host of the WJCT program on Saturdays. What's health got to do with it? And he joins us monthly. Let's start because we're talking about storms. There are some practical considerations for people from a health standpoint when we're moving into a serious storm.
Yeah, I'll start off. The simplest one is what you just said: stay home. What a perfect day to kind of stay home. But if you have to go out, the main thing is, from a health perspective, is make sure you have everything on hand. While things are open, make sure you have prescriptions, extra prescriptions. You got the over-the-counter stuff. Do you have a first aid kit? Those type of things are important. Check to make sure if you have a medical appointment that they're still open today. I know a lot of people are, but if they're not, don't venture out unless you have to.
My dentist canceled today.
So
So
so that's just check those things out so you're not on the road for no reason and find yourself in that regard, and reschedule as it comes through. But the main thing is it's about prevention, being safe, making sure you have your meds. If there was a concern about electrical power going out, make sure that you have either maybe like a generator or portable one. If even for a small refrigerator, if you're on medications that need refrigeration, like insulin or some other medication like that, or you have a device like CPAP or some other type of thing that requires electricity. This is the moment to just make sure that you got all that.
and this is obviously going to be a flood event, probably more than a wind event for our region. And those waters can be hazardous on their own. I mean, obviously, you want to stay out of them if you're driving, but what if you're wading around in them and you're trying to, deal with some flooding that's happening in your backyard?
Yeah, and one of the things is that you have to two things that can happen. Number one, you have to watch for hazards that are within those waters, if you will. Sometimes they are not. They may seem, oh well, it's just something that came down from the rain, but there could be mixed with other toxins and things of that sort. So just have some sort of protection, if you will. Don't go barefoot or something along those lines. I think that that's kind of self-evident. And try to stay dry where you can. I would my simple suggestion is if you don't have to go in there, please just get out to somewhere that's as safe and dry as you can.
So I want to shift now to talk about some of the medical headlines that you've been sharing with us. One of which is just COVID seems to be really prevalent right now. I feel like I know so many people that have had it recently. It really seems to be going around. What do we know about the current status of COVID?
COVID is having a summer surge. It started out in the West Coast, but it is now made its way across the entire country.
Like many trends starting in the West Coast.
It started out like with California was a wash. Now Florida has risen to have some of the highest rates as
Mhm.
well. We don't know what we used to know because they don't have all this reporting with mandatory testing and things of that sort because those days are long gone. But what we are seeing from wastewater, which is how they figure out positivity rates, it's very high. The positive test rates are what I saw quoted from as of recent as yesterday, we're up to 12%. One may remember that's huge if that's the positive testing rate. The good news, if there's some good news to be found, is that the hospitals aren't being overwhelmed. The severe illness version of COVID does not seem to be occurring, but that doesn't mean that everyone is going to have that same fate. There's a different variant. There's a group of variants called FLIRT. Love the
Mm.
name. It's actually an acronym for the mutations on how it attacks and attaches to you. Those are the prominent type, and it produces symptoms that look like a common cold, but with more punch, more tiredness, even gastrointestinal things like diarrhea and stomach upset is also a kind of a new thing that a lot of people haven't seen before.
So people who are interested in preventative measures and maybe getting a booster, how long does it take for those to take effect?
Yeah, like if you get a booster, it'll take a couple weeks at a minimum after that booster. But as a preventative, there are other simpler things that are faster. Masking still works. Using hand sanitizer is still a good idea. Those type of approaches are they work during the height of the pandemic. They can work now. The other thing is remember that if you have a fever, stay home. Don't get other people sick. It's about 24 hours that they ask people to be away from others for during the fever until the fever
And that's
subsides.
sort of the best indicator is a fever.
Fever is one of the indicator, but if you're feeling sick and all, wear a mask. Think of others in that regard. Stay home if you can. You're gonna have to check with your employer because all those rules have changed since the height of the pandemic. But that's very important to keep in mind.
Sure, especially with school just starting in Florida.
Absolutely.
Um, One headline that you drew our attention to this week is really interesting. It has to do with pre-doctor diagnoses. Explain to us what that is and how that's impacting doctors and patients.
So now that everyone is on the electronic medical record, what happens is that patients, you and I, as you get a test, let's say a blood test or an x ray or whatever test that is, those results, they're fed into that system like in real time almost. And as a result, if you, the patient, log in, you'll see a result that potentially your doctor or other healthcare provider has not seen. You are actually seeing it before they do. Problem is that when they see that, and let's say it's an abnormal result, you can go into panic. Let's say that they actually pick up, just to bring it out, a possibility of a tumor or something along those lines. You want to know right then and there what the plan is, but you may know before the doctor does. This is one of the side effects, maybe not positive side effects, of electronic medical records and the patient portal. That's where you go in and you're able to see those results. And that can lead to concerns. It's an unintended consequence.
And this is really something driven by legislation requiring transparency for patients to be able to see this stuff. And to be fair, even a positive diagnosis sometimes reads in a way that if you don't have the language and you don't have the training, actually sounds rather scary. It could be completely benign.
Exactly, and I don't fault anyone for reacting the same way. When I don't know and I see something along those lines, I'm like, "Oh my goodness," and no one's called me. The thing is that the healthcare system, uh, sometimes does the doctor, the healthcare provider, the nurse, they're not on that portal 24 hours a day, 7 days a week. So that result can come in there, and this is where we need, like, the healthcare team to help us out or a different process. But yeah, it's something that I hear, I live through, and I always feel bad because then I'm trying to kind of
Because you're getting
catch
calls
up.
from patients.
I go, "Why didn't you tell me about that?" "Well, I didn't see it. I didn't see it because it came up. You saw it before I did." And then you're trying to kind of backtrack and find out the plan. This is something that has to be fixed on the healthcare system side, whether by a healthcare team, or a simple fix would be don't publish it just until at least the healthcare provider, someone on the team,
It's
has
notified.
seen it.
Yeah, that makes sense. We're talking to Dr. Joe Sirven. He's host of the WJCT show, What's Health Got to Do with It, every Saturday. And he joins us once a month to answer your healthcare questions. You are welcome to send them in on any topic. You can reach us at 904-549-2937, or you can email firstcoastconnect@wjct.org. You can also message us on social media, and you can remain anonymous if you choose. I want to talk about this breast cancer study that recently came out because you've noted it's maybe more complicated than the headline. But basically, the headline was it's not necessarily safer or maybe doesn't make any difference if you have a double mastectomy, if you've been diagnosed with breast cancer, that the outcomes are basically the same over 20 years for women who did not.
Yeah, this was a fascinating one, but this is one that I would say has so much nuance to it that I wouldn't be running to take that headline with a whole change in the approach. This is a 20-year outcome, looking at survival rates at 20 years after breast cancer diagnosis. And what was found is that women who had either well, they looked at bilateral mastectomies as a preventative. The women who had those had the same 20-year survival rate as those who had one-sided lumpectomy or mastectomy. The big caveat to this study, and this is why I said I would hold off on any big change, is they didn't include women who had the BRCA1 gene, nor did they ask or include data about whether they were on hormone replacements, estrogens and progesterone, which can have a huge consequence here. So what I take out of this study, if I had to look at, is number one, women who have had mastectomy or lumpectomy on one side, they should feel this should actually make you feel better because it means it works for 20-year survival rates. For women about the bilateral, I would talk to your own physician and see what the risks are, especially if you have a genetic risk or if you're on hormone replacement therapy. Listen and work with your oncologic team before making any huge changes. Just so much nuance in this study.
There has been, I believe, studies in the past that looked at women who receive breast cancer diagnoses, sometimes using or being inclined to use the most aggressive, tactics to respond, whether that's a voluntary dual mastectomy or even, chemo and radiation beyond what an oncologist might suggest.
Yeah, and I think for some women, it may be that for some women that is not a wrong decision at all. They may be at such a high risk that that's the case. What this study just really kind of just told us is that I think for women who have low risk for other bilateral breast cancers and things of that sort, that it does not necessarily mean that having when they detect one cancer on one breast, that treatment can be sufficient if you're low risk. They just have to stratify that risk, and that's why you really have to be working with your team.
And I mean, I think to be said that women who do have more aggressive treatment sometimes do so to relieve anxiety, right?
Exactly, exactly, and that's a real thing. That's why I said this is one of those that as I kind of went delve deep into it, I would kind of take a pause for a moment.
I want to move on to a topic that I thought was really interesting that you flagged for us about taxes and health outcomes, which basically concluded to some extent taxes can have a health benefit. Explain that.
So this one was a study in the United Kingdom, and they put a tax on sugar, like sugary products. And does it alter consumption when you tax products that have this extra sugar? And lo and behold, if you charge more money for products with sugary, they found that sugar consumption of those products went down. The idea being this is a public health issue, that would be safer and healthier. That part doesn't surprise me. That immediately also then gets us into like, well, would that work in the United States with a very different approach? I still remember the days of Sarah Palin and her battles with the Bloomberg in New York City when they tried to do the big gulp,
The sodas.
the
Yeah.
sodas, and it became an issue of your choice, your freedoms. Uh, the reality is that there have been taxes for things like sugary sodas in the US that are city directed, Philadelphia, Oakland, things that sort, and they do actually show that they work. Of course, the other side is that the libertarians in us and independents, they may say, well, that's my choice. But yeah, those taxes do work, which is no surprise.
Is there believed to be a connection between those taxes on things like cigarettes and the rate at which they've declined? They seem to have lost a great deal of favor.
I think that that's one of the ways they handle that. This is a policy positive in the sense of on a public health front that yes, if you make something more expensive, that is going to be less likely that you're inclined to use it. But again, it does get into the issue of like independence and choice.
Yeah. Another subject that I would like to get to briefly is the issue of amphetamines in Syria and in the Middle East as something that has become a drug that people are increasingly dependent upon.
This is a fascinating story. So the drug is called Captagon. This was in reporting both by the BBC, Forbes, and the Washington Post. And what they had found is that the Syrian government actually have these state-sponsored factories producing this drug called Captagon. Captagon is a stimulant. It breaks down into amphetamine and another drug called theophylline. What it does is that it really makes you like a little more high, if you will. They even say almost with more courage because it's almost has like that low level of what happens when you take a stimulant, which is you just feel you're going to power through something. uh, they have a huge problem in the Middle East on this because they have a country who is actually keeping the Assad government empowered through the money, and they have this whole group of people that are captive with it, and they're addicted or captive to that drug, and it has become an issue out there. We haven't heard that in the U.S. so much, but that's doesn't take too much time before one starts to see those things translate over here.
And they said Syria is not quite a narco state, but there is a little bit of a connection there. What was interesting to me too is there are countries there where alcohol is either banned outright or very much prescribed for young people. And so you're seeing young people in Saudi Arabia and the United Arab Emirates become dependent on this drug as kind of an alternative.
It's crazy because again, it's a stimulant. It is not it like stimulants the same family as like cocaine's a stimulant, things of that sort. And these are not healthy items, but it can, keep you awake and definitely cloud your judgment in that direction. It is one that I would I would feel very nervous about as it came over whether how its addiction potential and things that sort. We know that it, like any of those, there's always some sort of addiction potential, but it is unusual to have it sponsored by a government.
Yeah. And this, in some cases, is even being used almost to fuel aggression.
Yes.
ISIS has been using it almost a kind of a terrorist tool because it sparks, as you say, this invincibility, this sense of, aggression and courage.
I'll give you even a historical perspective. It's not too different from the time of World War II during Nazi Germany. There used to be a drug that Goering, who was the military director, who had many of the citizens and soldiers take called Permethrin, which was a form of amphetamine that they would take so that they would work these long, endless fights and campaigns and get everyone, and they had a whole population in that way. This is starting to sound somewhat similar.
Well, Dr. Joe Sirven, it is so nice to have you join us every month. We appreciate it. We'll probably be checking in with you throughout this storm just to get some health tips. But thanks so much for being here today.
Always a pleasure, and